Good afternoon, everybody. I think we are right on time so that we can get started.
Afternoon.
Hello. Alrighty. Let's get started. Well, good afternoon and welcome to Mastering the Art of Market Research, one of Social Marketing at Griffith's Lunch and Learn series. I'm Dr. Joy Parkinson. So just before we get started, I would just like to make an acknowledgement of country. So Griffith University acknowledges the traditional custodians of the land on which we are meeting and pays respect to the elders past and present and extends that respect to all Aboriginal and Torres Strait Islander people. So welcome to the Mastering the Art of Market Research. As I said, I'm Dr. Joy Parkinson. I'm the Research Director at Social Marketing at Griffith, part of Griffith University. So can I just ask you all to mute your microphones? And it's best if you turn off your video as well. It just gives us a little bit more bandwidth to make sure that everybody can hear properly. I'm a consumer behaviour expert specialising in behaviour change. I've been working in the advertising and marketing industry for over 20 years and have been working at Griffith for almost 7 years now in the Department of Marketing. So I have plenty of experience in this area. So welcome along today. If you want to ask any questions, if you just pop those in the chat box and we'll get to them at the end. So who are we in social marketing at Griffith? Well, we're pioneers using behaviour change and using social marketing. So we're a really large team at Griffith University. We have over 40 staff and students. So we have a lot of HDR students as well as research staff. So just a little bit of background on what we do and our approach. So we use the CBE model, so co-create, build and engage and evaluate as well. And that's how we develop our programs. So as you can see there, we do a lot of different research and some of that I'll be talking to you about this afternoon. So co-design, looking at segmentation, EEG surveys, other creative solutions. We do interviews, focus groups. As I said, co-design, so we do run co-design sessions as well, which are really great for developing audience insights and translating them into programs that people actually use. So I know we have a range of different people on this webinar this afternoon, so welcome to all of you. I know there's many people who work in government departments and other agencies. I know we have some marketing agencies here as well and market research firms, so welcome along. So here's just a few of the things that we do. We've co-created the Blurred Minds program, which is about teaching young adults in high schools around alcohol and the harms of alcohol and how to have fun without alcohol. Leave It, which is about reducing dog and koala interaction, so really protecting our koalas. And then Waste Not, Want Not, which is a food waste reduction program. And these have all been conducted here in Queensland. So a quick question, just if you can type into the chat box, what comes to mind when you think of market research? Sorry, just having a slight technical difficulty here. Sorry, I just can't actually see the chat box at the minute. So hopefully some of the things that you said were surveys, focus groups, understanding your consumers or customers. And I will be talking about customers today, but I use that as a very generic term. What I'm talking about there could be your priority group, it could be consumers, or it could be participants in your behaviour change program. But just to make it easy and keep the language really simple, which I'm just going to talk about customers today. So market research is the function that links you to your customer through information. And it is simply a process for collecting market information. So your real goal isn't just about gathering or pulling together the information, but it's about gleaning insights from that information. So that means that we, are learning new things about our customer that we may not have known before. And that could be the key in getting them to purchase your product or participate in your program or to change their behaviour. And insights really are the difference between having the facts about your customer and really knowing your customer. And because my chat function is not working just at the moment, I will keep on moving. I was going to get you to give me some examples, but I will move on to the next part, and then we'll get to some examples in a moment. So why do market research? Well, as you probably are very well aware, trends are constantly changing. They change almost daily. So you have to, not just assume anything about your customer or assume that you know your customer, because the risks are just too high. I can see my chat box now. Great. Understanding consumer needs, gathering information on what consumers want or need, and getting a better understanding of our audience, and then testing successive activities. Yep, absolutely. And we'll get to a little bit more of that later as well. So doing market research really allows you to centre your business on customers. And when we're talking about a market-oriented organisation, that means that customers or consumers, participants come first. They're at the centre of all of the decision making. So doing market research also helps you to keep focused on what you're actually trying to achieve. So it allows you to pursue the right opportunities because you understand what those opportunities actually are. And it's also relevant and it's future oriented. So it's understanding about what people want or need now and into the future as well. So it's how they'd like to see things. So it's their ideal world. So I'm just going to talk to you a little bit about a program that I have been working on for the last 4 years called My Health for Life. So this is a program, it's a Queensland-based program, and it aimed to change the behaviour of 10,000 people across Queensland who are at risk of developing chronic disease, primarily type 2 diabetes and heart disease or chronic cardiovascular disease. And they also aim to do 200,000 risk assessments, which they've actually achieved those goals now. And the program used a collaborative approach to be developed. So one of the first steps they did was to have a look at the literature to see what types of programs were out there and what had worked. Then the second step in the process was to do market research. So they did a range of qualitative research with people in the priority group. So we try not to talk about people as target audiences so much, but rather because that indicates that they're passive, where we really want to engage them. So they engage with the priority groups to really get some understanding of what motivated them or prevented them from, doing healthy behaviours. So eating more fruit and vegetables, exercising more, sleeping more, drinking less alcohol, drinking less sugary sweetened beverages, those kinds of things. And we all know that we need to be healthy, and that was the assumption that they were working on, that people wanted to be healthy. But when they did the market research, what they found out was that whilst health was important, it wasn't the most important factor in what motivated them. What really was important was that they were happy and that they could spend time with their family. So happiness and family were the two most important things. And if they hadn't done the market research, they would have gone down a whole different track with how the program was developed and the messaging that was developed around the program as well. And the market research has been ongoing, not just before the program started, but continually through the program. So it's allowed the program to understand what works, what doesn't, what are the barriers, what are the supports, and also how satisfied they are with the program as well, and what they'd like to see done differently. So that looks at the things like resources, plus the facilitators of the program as well. So you can glean a range of information and insight that you can then use to inform the program. And so they've used a continual improvement model and fed all of that research back into the program development so that they've been able to modify things, because it's always really important not just to set and forget, but to continually evaluate and monitor and do market research. So just a couple of key findings. So we can see that the program's been really effective. At the end of 2019, so when the program has been running for almost 3 years at that point, we can see that there's some really good increases where we want increases, around fruit and vegetable consumption and physical activity, but some really important decreases as well. So around alcohol consumption, BMI, body weight, waist circumference, all of those types of things. So some really good behaviour change there. And that's based on getting some really key insights of the priority group who were going to participate in the program. So we need to do a market opportunity analysis. And this allows us to drive fresh insights from multiple sources. So we don't want to just take our sources, get our research just from one source. We really want to do it from multiple sources, and we're going to talk about this a little bit further on in the webinar. So we want to understand who are your target group and how to reach your target group, understanding where your target group are at the moment. For example, are they ready to change, or are they still not even thinking about it? It's in the too hard basket. And we need to be using a range of methodologies, tools and frameworks so that we have plenty of tools in our toolkit, so that we've got a range of approaches, because there's different reasons that we use different types of market research approaches and methodologies as well. So some of the key to success is to develop a really deep understanding of your customer. So as I just talked about in the My Health for Life example, really understanding what motivates them. And it's, for example, if we're trying to get people to eat more fruit and vegetables, but they find it's a little bit too expensive and they need to buy their children school books. School books might be, more of a priority. So we really need to understand how to make things more accessible, for example. And market research is really how you get there. It's really how you can develop those deep and rich insights that you can then inform your marketing decisions or your program or product development. What would you want to learn about your customer today? So that's what we need to ask ourselves. And I want you to think about this now. What would you want to learn about your customer today? What types of questions would you actually ask them to find out that, those insights? And at least one insight will be waiting for you to discover, no matter what. There's always something new that you can learn about your customers or your consumers. And the more insight that you have, the better informed you are to make better decisions. So we can make evidence-based decisions, and we can be reasonably confident that what we're going to do will work. And of course, we have to test that. So what are some of the benefits of doing market research? Well, how are you making important business decisions today. Market research takes the guessing out of it. It allows you to make informed decisions, as we said before. It gives you good information as well, and it takes the guesswork out of decision making. So what are some of the things that market research can actually tell you? So is there a need for the product or service? Do people need to change their behaviour? It helps to reduce the risk so that we have that understanding. So if we are wanting to develop a new product or service, by understanding if there's actually a need for it, we know that we're going to be opening up a market so that we can sell our product or service. So of course that's reducing some of the financial risk. Market research can also tell you about your competitors. So we want to know who are our competitors. And in the case of goods and services or products and services, it could be a range of competitors, and we have to think about the broader market as well. So if we're talking about the beverage industry, for example, we can be talking about alcoholic beverages, non-alcoholic beverages. We can be talking about hot beverages or cold beverages. We can be talking about cola or iced coffee. There's a whole range of different competitors. And then if we're thinking about behaviour change, we need to be thinking about what competes for our priority groups' time, money and effort. So that gives us a different perspective on competitors and competition as well. We also want to know how big is the market. So how many people are out there, or how many competing products or services have we got? Or how many competing programs are there that are competing for our priority groups' time, money and effort? Then we can identify our opportunities and problems as well, so that we can come up with solutions, or we can develop a new service or program when we identify an opportunity. And it also helps us to develop our strategies as well. So it allows us to understand who our priority groups are, what the competition is, how big the market is, and then the types of strategies that we need to win that market share. So we need to identify our priority group, and that's what market research can help us with. And there's a range of ways we can do that, and we'll talk about that a little bit later. And that allows us to build personas and take a segmentation approach. So not a one size fits all, but allows us to categorize, for want of a better word, our customers and our priority groups so that we can develop specific offerings that are tailored for them. But we will talk a little bit more about segmentation as we move on. It also allows you to understand your priority group's values. So what do they actually value? As I talked about before, the priority group for My Health for Life valued happiness and valued family. It helps you to understand their norms. So does everybody else walk their children to school, or is it just me? Or why would I want to walk my children to school if no one else is doing it? So it allows us to understand those types of norms. And also what motivates and influences them. So what actually motivates them? What's their driver? Why do they do what they do? It really allows you to understand that. So it allows you to understand, another thing it can do is allow you to understand what they think of your product or your service as well, or your program. It can also allow you to understand what they think about your products, your messaging, your ads, and as somebody said in the chat box, it allows you to test those things so that you can see if a message actually resonates. And sometimes just testing it in a focus group isn't quite enough either. We have to do more testing than that and more market research and use a variety of different methods apart from self-report or a one-off snapshot to really understand what our priority group actually thinks or how they respond to our messages or our ads. And it also, market research also allows us to monitor satisfaction or marketing performance. So as I said before, in the My Health for Life program, it allows the intervention team to understand whether participants are satisfied with the program, and if there's, so really looking at that service quality to understand where there are areas for improvement or things that they need to keep doing the same that really work. So that might be around understanding the touch points that are used, and whether they need other additional touch points, for example. So I just want you to take a moment and think about, what does creating value mean for you? Oops. So what does creating value for your customer mean? So if you can just type your responses into the chat box, that would be great. Thank you. And remembering that there can be different types of value as well. It's not just a financial or economic value. There's other types of value. Yeah, making life easier or better, or making it easier to do business. Yeah, absolutely. Yeah, creating more value relative to competitors or competition as well, ensuring your customers receive the best product or service. Yeah, providing a product or service that actually helps your customers. So making life easier, making life better, making it easier to do business are all really important. And creating value can be about providing benefits or creating benefits for our customers. So giving them something that they actually value. So that could be emotional value, as I talked about before. People want to be happy. So that's what we want to provide for them, to give them something of value, is something that makes them feel good and feel happy, for example. Or it could have some sort of functional value as well. So we want them to be able to use the product, the service, or participate in the program. So there's a range of different ways that we can actually create value. So we can work with our customers to actually come up and co-create and develop something that they actually value. So when we're creating value for our customers, we want to get an in-depth understanding of our market and our customer. So we want to understand who they are and also how they behave. So what do they actually do and why they behave as they do? So gleaning some of these key insights about who our customers are and how they behave is really, really important. So if we're wanting to change their behaviours, we need to know what they're doing now, and then understand why they actually do that. Is it because they get enjoyment out of it? Is it because they don't have time to do anything else? Or is it because everybody else around them is doing that? So it's really important that we understand the who, the how, and the why. So moving into marketing planning, which is where marketing research sits as part of this process. So our first step in marketing planning is to do a situation analysis, or a SWOT. So looking at our strengths, our weaknesses, our opportunities, and our threats. And of course, our strengths and weaknesses are internal to our firm or organisation. And then the opportunities and threats are external. So what are the things happening out in the environment that we can take advantage of? So build something based on an opportunity. And what are the threats? What are the things that we have to think about? What's happening out there? And we could come up with plenty of examples over this last couple of months that have been real threats that we may not have thought about before either. Then the next step in the process is our strategy development. So thinking about, where do you want to be and how are you going to get there? So it's like our roadmap to achieving our end goal or our objective. And usually hand in hand with developing our strategies is where we develop our objectives as well. So what are we trying to actually achieve? Then we move into our marketing program developments. So using our 4 Ps or 7 Ps, so our product, price, place, and promotion. Could also be including our people, our physical resources as well. And then implementation. So how are we doing against our KPIs? So what are our objectives? What are our key performance indicators? that we are trying to achieve. And then we refine our strategies around those as well. And that could be, you know, things like customer satisfaction. So this is how we actually translate our insights into action. So that's how we, you know, implement our program, implement our product or new product, or maybe changing an offering. But this is how we actually take what we've learned in our market research and then apply it. So develop the tactics as part of our strategies that are going to help our customers take up our program, our product, or our service. So just coming back to decision making, and you know, we talk about decision making a lot when we're talking about market research, because market research actually informs our decision making, or it should. So to make a good decision, you need good information, and market research can help you make informed decisions. So you've all heard the old saying of garbage in, garbage out. So if we don't collect good quality data or good quality information, we can't make good decisions. So if we're collecting the wrong data, or we don't know what question we should be asking, so we're not collecting the right information, we're not going to make very good decisions, are we? So what are some of the things that we need to consider when we're doing market research? Well, first of all, we need to think about, why do we actually need the research? What's its purpose? What's it going to help us do? And why do we do it? Because we always have, we don't have infinite resources. We're always working with limited resources, whether that's human resources or financial resources, but we're always operating within constraints and within boundaries as well. So we need to, before we start, clearly define the reasons of why we're actually going to undertake or conduct the market research. And then we need to think about our costs, our budgets, and timelines as well. So how long have we got? When do we need to make these decisions by? How much money have we got? And how many people have we got that we could have on the ground that can help us to actually conduct the market research? And the value of the research has to exceed the cost of doing the research. So there's not much point spending $20,000 doing some research if it's only going to add, you know, $1,000 or $2,000 of value to our firm or our organisation. And again, if it's worth doing well. So we want to be process driven and systematic in our approach to market research. And we need to make a commitment to use the results. So we're not just conducting the market research for the sake of conducting research. We need to make a commitment to use the results and to budget to implement the findings as well. So we want to make sure that we can actually implement what we're doing and translate that into practice. So we need to understand the nature of our problem to ensure the right problem is being investigated. So by understanding what the nature of our problem actually is, will allow us to collect the right information. So if we are having a problem with people who aren't happy with our service, we need to understand, what is the true problem? Is it the service, or is it some of the service providers, or is it the way that they're doing it? Is it because people come into, and this may not be happening at the moment, but is it because people come into their facilities and they're not clean, for example? So we need to understand, is it something to do with the actual physical space, or is it something to do with the facilitator? When they come in, are they not welcoming, or are they really bossy? Do they say, no, I just want you to sit there and be quiet, or they don't offer a cup of tea or something, and that might be an expectation. So we need to understand, what is the nature of our problem? And that allows us to collect the right information so that we're asking the right questions. So formulating the problem correctly in order to execute the right research. So really important, especially with such limited resources. We want to make sure that we truly understand what our problem actually is. So then the steps that we take or undertake in the market research process start in step one. We want to understand the background. Then step two, we want to translate the business problem into a research problem. So that's when we come up with our research questions to evaluate. We want to identify something, or we want to determine something. So that could be, we want to identify what are the key drivers for people to give up smoking. Or we want to determine if shelf space or shelf position in the supermarket actually makes a difference to how many products we sell. So we want to think about those, leading our questions with those types of terms. So, examine, identify, determine, evaluate. Then our third step in the market research process is to create a hypothesis. And that's what's going to drive the research. So that's where we might come up with, an idea around what we think might be happening, or what we think might be working or not working. And then we want to define our objectives as well. So what are we actually trying to achieve with our market research? So that might be understanding what our consumers' values are, or we want to actually segment our market. So we need to make sure that we have enough segmentation bases in our questions to help us to do that. So I know I'm talking a lot about questions, but market research is all about asking questions. So the questions that we need to ask ourselves, we need to ask the right questions. And again, I've said this several times. So we have to make sure that we're asking the right questions to get the information that we need. And we also need to think about, what's the most important question to ask? What are we really trying to tap into with our market research? So these are all of the things that you need to be thinking about before you even start to do your market research. What do we actually want to know? What's the most important thing that we want to know from this market research? And it could be why people are not doing something rather than why they are doing something. Why are they not buying our product? Why are they not participating in our program? Why are they not going for a 30-minute walk every day? Why are they not eating 2 pieces of fruit every day? Or it could be, why are you still smoking? Or why are you buying takeaway every night of the week? So we really need to think about what is the most important question to ask. So we need a research design. So that's a plan or a framework. So that maps out what we're actually going to do. And it provides a guide for our data collection so that we know who we're actually going to sample, for example. So who are in our priority group, who do we actually want to talk to? Or what types of information do we actually need? How many of those do we need? And then there's, of course, the different approaches as well. So 3 different approaches to market research: exploratory, descriptive, and causal. And you'll have no doubt heard of these before. So exploratory research, as its name suggests, is an exploration. So it's when we don't know a lot about the topic or the question that we're looking into. So it allows us to do further research to actually understand the problem. And this might be the first step in our process. And it also allows us to increase familiarity with the problem so that we can really understand what's going on in the marketplace, for example. But it's just that first step in the process. Then there's descriptive, which is the most common type of market research. So we already have some information. So some of that information might be based on our own knowledge, our own experience, and that could be from working in a particular area for a very long time. So we already know a little bit about our problem or about our priority group, but we need some more. So we might have some, secondary data sources already. Descriptive research allows us to describe the characteristics of our priority group. So as I said before, when we're coming up, or when we're looking at segmenting our markets, We really need to understand who these people are. And we can do that based on a variety of bases. So we can look at demographics, which is the very baseline. I wouldn't recommend just using that. When I am lecturing, I always get my students to look around the room, and I would get you to do that if we're all in the same room. And my students are usually very similar when we're talking about demographics, so similar ages. Of course, there's a range of genders in the room, but they're similar ages. They're all studying at university. Often their income backgrounds are quite similar as well. But I get them to look around the room and see if they can find anybody else in the room who's dressed exactly the same as them. And apart from people wearing all black, there's never two people who are dressed alike. So that just demonstrates that just basing decisions on our priority groups just on demographics isn't really enough. We need to understand their values, what drives them, what motivates them, what are their attitudes and thoughts and opinions about particular topics. Where do they live? Do they live in regional areas, or do they live in metropolitan areas? Do they live in low SES areas or higher SES areas? Lifestyle, what stage are they at? What's their behaviours? What are they doing now? So all of those things help us to come up, and their psychographics as well. All of those, understanding those similarities helps us to group people into different segments. And there's a range of data analysis techniques that we can use to do that as well. And this can allow us to estimate a proportion of people who behave in a certain way. So it starts to allow us to make some predictions, which is really important as well. So we can start to do some modelling of who might purchase our product, or who might participate in our program, or who might attend our event. And that's, of course, really important. And then, of course, we have causal research, which is probably the most uncommon because it is really hard to do. And this is where we're testing cause and effect. And it's quite often really difficult to attribute effect to any particular cause, especially in the real world, because there's so many other factors at play that it's really hard to tease that out and separate out what the actual cause is. But things that we do causal research in could be, shelf impact, shelf placement, as I said before. Does where you place the product on the shelf, at which level, does that actually impact sales? So if we have things at eye level, we know that that should make people buy more of them. So we want to truly test that, because, brands can pay a premium for shelf placement. And if that's not making any difference, well, why would we want to pay the extra, for example? So often we do cause and effect research in experiments so that we can actually control the conditions. But for many of the behaviours, products and services that we actually are trying to sell or get people to uptake, operate in the real world and in a living laboratory. So much harder to actually control for things, because there's, a range, it could be the weather. There's so many different factors at play that we can't always attribute our intervention with the effect. But we can talk about how much that it might contribute rather than attribution. So we talk about contribution. So that's what causal research can allow us to do. So moving into research methods or market research methods. So these are actually how we obtain data. And we can use one method, or we can use multiple methods. And ideally we want to use multiple methods so that we can do what's called data triangulation. So it's allowing us to double check or triple check our results. So we're not just asking 10 people about something. We might then run a survey so that we can just double check that what our findings were in our interviews match, so that we can be more confident in our decision making. So what are some of the options that we have when we're talking about market research? Well, we have primary and secondary, and you should usually start with secondary, and because it's usually either very cheap or free. And often publicly available. Or it could be research or data that we already have in our organisation, so we can draw on that. So it can be on past campaigns, for example, or when we're talking about external data, could be ABS data, for example. It could be from industry reports that are freely available. So we want to draw on that first before we actually move into primary data collection. So primary data or primary methods can be quantitative or qualitative. So qualitative is, you know, basically words. So it could be about our target or our priority groups' feelings, their thoughts, those types of things. We can look at lived experience, and increasingly we're moving towards a lived experience when we're talking about behaviour change. And I'm sure that many of you are behaviour change agents, given that you've come through social marketing at Griffith. So when we're drawing on the lived experience, it's really understanding how people behave in their normal and natural environment. So it really gives us some deep insights into what they actually do and how our program or how our behaviour can actually fit into their life. How can we make it easier for them? It provides all of those types of understandings. And what are the barriers? What would be stopping them, or what could potentially stop them from performing the behaviour that we want them to perform? Then we have quantitative. So, you know, that involves numbers and statistics. So that can be primarily surveys, and can be observations as well. And then we have experimental. So that's where, as I talked about before, you know, it might be in a lab, or we might just be showing different stimulus. It could be different ads or different labels, that type of thing. So we can actually test which works better by controlling out everything else, so that we know that there's no other that's actually affecting our participants. So, a toolbox for market research. So as I said before, with secondary data, there's a range of sources that we can draw on. For example, industry data. But now we also have access to social media data, and there are privacy and legislation issues around that. But we can do some data mining as well in social media. So we can really get a feel for what are our priority groups thinking and doing. How do they behave on social media? We can do sentiment analysis, for example. So we might want to understand what people are thinking around the social distancing laws, or now as we are starting to open back up, how are people feeling about that? Are they feeling safe and secure? Are there any opportunities out there for our firm, for example? What could we be doing? How can we be tailoring our offerings based on that? Then we have our primary data, which can be observations. So that can include new techniques as well. So observations, we used to do a lot of covert observations where we go out with our observation sheet, our check sheet, and we might count how many people drop litter on the ground. Or we might be in a cafeteria where we are looking at how many people choose salad or fruit, or who choose the big lasagna or the steak. So we can do observations. But now we've moved into using other techniques as well that are not self-report. So using EEG and eye tracking, so we can actually see where people's eyes go to when they look at a label, for example, or an ad. So we can really start to, you know, get some key insights into where we should be positioning things, for example. And then we have our self-report data or self-report methods. So that's things like interviews. So it could be in-depth interviews using, you know, they could be structured. So using a type of survey or questionnaire, or they can be semi-structured. So more open and letting more of a conversation flow, where we can start to ask more questions and probing questions to really dig a little bit deeper. Things like surveys as well, all self-report. So it's based on our perceptions of what we think. And sometimes that's not super accurate. That's why it's really good to use multiple methods as well. And then we can also use diaries and journals. And that can be part of that lived or action research, lived experience as well. So getting people to write down what each meals they eat each day. And we can use that with photo diaries as well. It's really easy to do now with smartphones, where we can just capture photos of every meal, or every time we eat food, or every time we have a glass of water, for example. And we can journal things as well. So actually writing down how many times we thought about eating chocolate, for example. Sorry if I've just made you all feel like chocolate. Then we have, let's move on to qualitative research. So what's the purpose of qualitative research? You know, it seems pretty cumbersome, doesn't it? You know, doing interviews and then somehow you have to analyse them. But qualitative research really provides us deep and rich insights that quantitative research is unable to do. It has a different purpose. So qualitative research allows us to access people's emotions, for example, and to get an in-depth understanding of what they're thinking and why they do the things they do. We can really tap into the different drivers, and I'll talk a little bit about why you do this in a moment. So some of the techniques we can use are interviews, focus groups, co-design sessions, ethnography. So that's where we actually become part of the person's life. You know, we might live with them, or we might live in a community, for example, and that allows us to take detailed notes and observations and reflections around what they do. Journaling, so that can be using reflections as well. So for example, part of the My Health for Life program that I am evaluating, we're working on adapting the program for people in the Cape and Torres, so people north of Cairns, and including Thursday Island and Horn Island as well. So as part of that, we get them to do reflections on each session. And so how they actually do that is they have a couple of questions that they have, and they respond to those each time, and they actually record themselves on their mobile phone, which is really handy. So they can actually just talk about their experiences and respond to each of those questions. There's, I think, 3 or 4 questions. And then we can take that, we get it transcribed, and then we can analyse it and do some loosely termed thematic analysis. So really understanding what are their drivers and barriers, what was good, what was bad, what worked, what didn't work, what they liked, what they didn't like. So yeah, different ways that we can use qualitative research. And then of course there's the lived experience as well. So that's more than just interviewing people, and that can involve a range of different qualitative approaches as well, and usually over a period of time, so that we are really immersed into the people's lives. So actually understanding what they do, and it's getting people or consumers or customers to be part of the research. So they're part of the process. They're not just the end user, or they're not just the participant at the end that we are talking to. We are working with them. So qualitative research is really dynamic, so it can change really easily, and it's a lot more fluid than a quantitative approach, and it's very flexible as well. So it allows us to really tap into some of those deep insights, but it can be very subjective. So if I'm the only person analysing the data, it's going to be very subjective and based on my view of the world. So I bring in all of my biases and backgrounds, and whether I like smoking or I don't like smoking, for example, is how I'm going to view the results of that research. And often we only have a small sample as well. So we can't necessarily generalise it, but often it gives us those key, or always gives us those key insights that we would never find out through just an online survey, for example, or a self-response survey. But what happens when we can't do this face-to-face? At the moment, for example, very difficult. So we have to use Zoom, for example. or we can get people to do recordings like I talked about before with the reflective journals. So there's a range of different ways that we can do this, and I'll talk a little bit more about it as we go. So moving on to quantitative research. So the purpose of quantitative research is to quantify our thoughts and actions. We often do this through surveys. And when we're talking about surveys, they don't just have to be a one-off survey, one time only. We might want to do a longitudinal survey. For example, we might want to do something at baseline and then at the end of our program or the end of our advertising campaign. Or better still, we take it at several time points, but we always want to make sure that there's an even amount of time or equal amount of time between our time points as well, so that we can run our data analysis. And surveys allow us to understand current or past behaviours and or predict future behaviours. So for example, how satisfied are our customers? So we can easily ask that. Now, on a scale of 1 to 5, how satisfied are you with this webinar? From 1 representing not at all satisfied to 5 representing very satisfied. Or we can ask, how will a price impact our sales? If if you were looking at buying a new smartphone, if we were selling them for $200 with X benefits, would you purchase it? Or if we were selling it, if we wanted some extra features and we added an extra $50, would you purchase the more expensive one, or would you purchase the less expensive one? Those types of things. So things that we can actually quantify. And it can allow us to statistically reflect the views of the population, because it allows us to predict things and model based on the findings. So we have confidence, a 95% confidence, basically, that something is going to happen the way that we are predicting. Not always perfect, though. So this should say quantitative research, not qualitative. Questions should be written to present numerical results. So people often ask, how do we actually write questions for a quantitative survey? And when in academia, of course, we use valid and reliable surveys or questions that have been used previously. So they've been validated and they have psychometric properties. And we always ask the same question in different ways at least 3 times. And again, that's that triangulation to make sure that we're actually capturing what it means. So when we're talking about quantitative research, we're thinking about how often, for example, how often do you eat out in a month? So we can quantify that. It could be once, it could be 30 times. Or how far are you willing to drive to purchase something or participate in a program or to do Saturday morning sport? Or how often do you catch public transport? How often do you catch public transport to work? How far do you drive each day to work? All of these things can be captured numerically. On a scale of 1 to 5, how strongly do you agree with the statement? I am confident in my ability to use my smartphone. Those types of things. From not very confident to very confident, 1 to 5. And we need our sample to be representative as well. So we need to make sure that we include people in our sample, from different demographics, for example. So we might want to look at young people versus old people, males versus females, people who earn a lot of money and people who don't earn a lot of money, people who are well educated, or people who have very little education as well. Sociographic, fits in with that as well, and geographics, for example. So we want to make sure that we're including people who live in regional or rural and remote areas, as well as people who live in metropolitan areas, so that we can really get an understanding for what's the same and what's different. And there's likely to be differences as well. Our quantitative questions need to be really well formulated and they need to have mutually exclusive response options. So we can't say, oh, well, I'm a little bit of this and a little bit of that. That's where we have scales like the 1 to 5. But we need to be able to just choose one option. Or sometimes we might ask them to choose, you know, all that apply, but they are still separate. So it might be, how do you normally get to work? Well, some days I ride my bike and some days I drive my car, and then other days, depending on my work day or whether I have to pick up my children from school, some days I might drive. So I can check all that applies, but they're still mutually exclusive response options. And quantitative research allows you to segment or to develop personas using quantitative research. So if you think about those things that I just talked about, so even how I get to work normally, that's behavioural. So that could allow you to segment me into the bike riding group, for example, or the group of women who ride their bikes to work, or the group of middle-aged women who ride their bikes to work, because they think that it's really important to do that. It's really important for the environment, and it's really important for their health and well-being. So you can see we're starting to develop a persona there around those people, like myself. So yeah, quantitative research can provide you lots of different insights that are very usable. And using segmentation, you know, it's one of, you know, marketing's key toolkits, and it's what really makes us stand out from lots of other different approaches as well, that we don't do a one-size-fits-all. Developing personas is really useful in that it allows us to describe the groups of people more as a person, so that we get to know that group of person and think about them, that group of people, sorry, and get to know them more as a person, so that when we're coming up with solutions, it helps us to craft those solutions to fit that particular type of person. And you can have fun with personas. You don't just have to have them as people or with boring names. You know, they might represent different animals or different fruits, for example, or butterflies. There's a range of different approaches that you can take and make it a little bit fun, and you can come up with some great animated caricatures as well to represent those personas. And that's really, really helpful. And I'm sure many of you have seen, for example, you know, the Roy Morgan value segments. And there's a range of different segmentation approaches as well, and different personas. You know, we talk about the worried well, for example, in health. So, you know, we know what they usually are very, very healthy and fit and within the healthy weight range, but they worry about their health. So they actually still actively do things to make sure that they're staying healthy. So just by the description of them, we get a real understanding and some insight into what actually drives them. So really, really important. Then moving on to observation research. As I said before, when I was talking about observations, that we would talk about, you know, I had an example. So why do we do observation research rather than just using self-report? I mean, everybody is really honest about how much exercise they've done, aren't they? Maybe not. Everybody's really honest and really knows exactly how many alcoholic drinks they have in a session or in a week. And they're really honest about how they report that. Depends. If you truly only have one, it's very easy to say, I have 1 drink per week. But if you have a couple, 2 or 3 every night, it's very easy to lose track, for example. So sometimes we need other methods that are a little more accurate and give us a little more insight into what people are actually doing. So if I asked you, you know, what would you say if someone asked you to describe how you or how to do washing, for example? You would tell me a process, but you would only tell me the main steps, which could be, well, I go to the dirty washing basket, I tip the clothes into the washing machine, I close the door, I put the lid down, I pour detergent in, and I close the cap, and then I turn it on. But that's very simplistic. But there's probably a lot of other things that you actually do as well. So you might be missing some of those really important little steps or unconscious compensating behaviours that, you know, really help us or provide that really deep insight that we're actually looking for, and that might drive a new idea. So if we think about when we're doing laundry, you might say, oh, I just pour the detergent in, or whereas you don't actually do that. What you do is you get the lid, you pour it into the lid, you measure it out, and then you tip it in. And then you get some fabric softener or some antiseptic or whatever it is that you do, and you pop that in the little softener thing. But even before you've put the clothes into the washing machine, you might have made sure that they were all turned in the right way and that there were no socks hiding in anybody's jeans, or that you might have checked all of the pockets for tissues, for example. So there's a range of little things that you actually do, or if you're me, you will have sorted them into lights and darks, and definitely never have a towel go in with your clothes. So there's lots of little things that we actually do. So if we're thinking about, you know, washing detergent and using the cap as a measure, you know, now we have the little slot in the lids so that it captures the detergent so that it doesn't run everywhere when you put the cap back on, because you've used it as a measure. It's got a line in there. Where do you think those things came from? Well, they came from observations of how people actually did their washing. So that's why it's really important to do things like observations. Then we also have ethnography, as I said before. That's a real live with your target participants and walk in their shoes. So it allows you to make observations of what they do and how they do it within their context as well. Then we also can use simulations or covert observations. So that's when people don't know that we're actually watching them. So we can do that in a laboratory environment, or we can do that in the natural environment as well. So we might sit at a bar, for example, and we might just check off how many drinks people order, or how many, do they go to the bar and just buy one drink for themselves, or do they get into a shout where they are buying several drinks? So we can then observe that and check that off our checklist as well. Do they buy, how many beers, how many wines, how many spirits do they buy each time they buy a round, for example? So observation research is about systematically watching someone do something, either in their natural environment or in a simulated environment. So in a simulated environment, that's where we're watching them. It could be in a kitchen, for example. So we might be watching how they move around a kitchen. How do they move between the fridge and the stove and the sink? How do they use the drawers? Those types of things. Where do they get their implements from? Or how do they go about cooking a meal or preparing a meal? So it's a simulated environment, and that could be, if we're developing a new stand-up, sit-down desk, we might do that in a simulated environment as well. So we can just observe how people are actually doing the behaviours. Then when we come to samples, that's really a really important consideration when we are doing market research. So how do you think your predictions would differ if you talk to all the people? Would it hold right across everybody in the population? Probably not. And we've talked a lot about segmentation as well. So it's really important to get your target right, or your sample right. So we need to narrow it down. So we need to think about who we want the sample to actually represent. And do we want them to represent the total population, or the total population of our target or priority group? So we need to set some inclusion and exclusion criteria. And I've touched on this before as well. So we might want to include only adults, for example, or we might only want to include people who are over 45, or we might want to exclude certain people. We might want to exclude people who have a university education. And then we need to think about the size of our sample as well. And so that all comes down to the type of research we're doing. Are we doing quantitative or qualitative? And of course, qualitative research, much smaller samples, more expensive to do. So we need to think about our time and our budget, you know, and the representation that we're actually trying to achieve as well. And then if we think about quotas, that's how we ensure that we have, you know, a certain number of people in certain groups, for example, age groups, or it could be that we need, we want to make sure that we have a representative sample of Aboriginal and Torres Strait Islanders. And if we're looking at an Australian population, we want that to sit between 3 and 4%. Or we might want a larger sample of Aboriginal and Torres Strait Islanders, for example, depending on what we're actually trying to do. So we want to make sure that we have a range of people in our actual sample so that we are getting perspectives from, you know, different people. And then sometimes there might be special considerations. And at the moment, we really do need to think about, you know, whether they have internet access, whether they have a device that they can do an interview or do an online survey with us using Zoom or some other, or Skype or some other mediated or technology mediated platform as well. So we need to think about that. Do they have fast internet? You know, these are all the things that we need to consider. So moving on to questions. So ask a stupid question, get a stupid answer. Well, when we're thinking about market research, it's probably better to say, ask a question stupidly and get a useless answer, because I really don't think there are any stupid questions, but there are definitely better ways to ask questions. Two different types of questions: open-ended questions and then closed-ended questions. So closed questions or closed-end questions have limited response options. So they're what we were talking about in the quantitative data. Whereas open-ended questions don't limit our responses. So they might be an open text box, for example, or a question in an interview. So for example, tell me about why you shop every day versus which of the following are the reasons why you shop every day. So you can see that one allows you to tell a story, whereas the other one just gives you very limited response options. So open-ended questions also allow the interviewer to actually ask follow-up or probing questions so that you can dig a little bit deeper. And sometimes people will say, it sounds really interesting. So having open-ended questions actually allows you to ask them more about that. So tell me about that. And often that's where you get those really key insights or those little gold nuggets of information that really allow you to develop something that actually works just because of one little thing that they have said. And sometimes it may be just a small thing that they say. For example, if we're interviewing people from different cultures, they might talk about how for them, they would never eat chocolate in public. I'm just making that up. So you know that you shouldn't, that your product, or you might not want to be selling then chocolate in public places, for example. So another little thing about open-ended questions is you don't want to ask leading questions either. So you don't want to start your question out with, don't you agree that the current government is doing a good job? Or don't you agree that the current government is doing a bad job at blah, blah? Because you're bringing your own biases and shaping what the response is from your participants. And that's not what we want. So with surveys, a few simple rules to follow. So you always want to test your questions first. Make sure that they're easy to understand and easy to answer. We need to use a funnel approach when we develop our questions or when we're developing our survey. So what I mean by that is we start off broad or wide. So we're getting the easy information first to ease participants into the survey, because we don't want them to think too hard and then exit our survey if they're doing an online survey. We want to make it friendly and easy for them. And those first questions might just be about providing context for their answers. So you might not even use some of those responses, but it also sets the logic for our survey. And it also can limit bias to our later questions as well. So we don't want to ask all those really important questions right up front. You know, if we're talking about physical activity, for example, we don't want to kind of throw them off at the start to bias their answers as they get to the end. And then as we move through the process, so going from broad or easy questions, we then drill down to the more specific questions. So really getting into what we want to ask them and what we want to know about. So almost to the end. Thank you for hanging in there. So then when we come to our method decisions, there's a whole range of different methods that we can use. How do we decide? You know, we can conduct our research over the internet. We can use mail or telephone or intercept surveys at shopping centres. We can do focus groups or interviews. We need to think about, you know, how many participants. So this all really comes down to budgets and also the demographics of our participants. So if we're looking for, you know, a sample of people who are over 70, we might take a very different approach to people who are between 18 and 25, for example. We need to think about what information are we looking for? Can we answer it in a survey, or do we actually need some deeper insight? So we use an interview, for example. And just jumping to the bottom point, isn't an intimate or personal topic that can help us decide as well. So if it's something very personal, we don't want to do it in a focus group, do we? Because we don't want people talking about very private behaviours in front of other people. They're probably not going to be very honest. So that might be better in an interview, or it might even be better in a survey where they can do it anonymously. Think about what's your budget and time frame? Do I need it fairly quickly? Survey's probably better. An online survey, even better than that. Then thinking about your target audience. Where are they and how can I reach them? Can I reach them via social media? Or do I need to reach them via email or some other way? What are their literacy levels? So I don't want to be giving them a 70-question online survey if they have really low levels of literacy, because that will just scare them and they won't answer any questions. So we need to consider all of these things when we're actually deciding on what method we're going to use. And remember, we always need to think about what's our research question? What are we actually trying to understand here? What do we want to know? So doing market research in a COVID world. So as you know, things are a little bit different at the moment, even as people are going back into the office and back to the workplace and schools are opening, shopping centres are back open, you know, things are happening. But we still need to be very mindful about conducting in-person research. So we want to think about participant safety, but we still need audience feedback and insights to develop effective programs. So we have to transition our in-person research to online environments. So we can be using virtual focus group technology like we're using today, or video conferencing for interviews, and then using our multimedia surveys as well, which we've always done, but we need to really be thinking about that. And sometimes that is actually at the moment to capture our data. So if we start with some of our proprietary online recruitment methods, to find our at-risk population. So we might find those in very specific Facebook groups, for example. And then we can conduct all of our research online from start to finish. So we really need to consider those different methods that we can actually use at the moment. And using social media is a great way to recruit people as well, because you really can tap into people. And it doesn't mean that you have to go into a group, but you can use paid advertising that allows you to at least have your ad pop up in someone's feed, and it might be based on keywords, for example, that they regularly search or are part of, or is part of their feed. So as I said, using our very targeted social media ads can be really cost effective, very cost effective way to recruit participants from targeted populations. And that can be, you know, rural, urban, recent drug users, or it could be low income people or multicultural people. You know, there's a whole range of options that we've got there. Or we might be looking to recruit parents about what they're feeding their kids, or how they're getting them to do physical activity at the moment, or how they went around homeschooling. So, you know, by avoiding using overused research panels, digital recruitment actually can allow you to exceed your recruitment goals. And I've had some great success over the years using social media to recruit, within Australia, but also internationally as well, on a range of different studies. So looking at breastfeeding, looking at weight management, looking at disaster preparedness. So yeah, whole range. And school lunchboxes has worked a treat. Very cheap, and you tap right into the target audience that you're actually looking for. So it has allowed us to glean some really significant insights into our target audience as well. So we've recruited interviews, focus groups, co-design, as well as survey participants using those methods. So they really work well. Then almost to the end. So of course, all good market research needs a report, because we love research reports or reports. And these days, you know, getting a graphic designer or using PowerPoint to develop a report is a great option as well, and one I highly recommend, because you can pop in infographics, don't have millions of words like I have had today, but you can make, you know, draw out those key insights and key learnings really nicely. So remember that your report needs to be read to be used. So you need to engage the audience. So we want them to buy in. So make it interesting using infographics. Know who your audience actually is. Who's going to read the report? So you want to tailor it to those audiences. And remember, you always need to include the background. Why did you actually do this research? Why was it important? Make sure that you explain your methodologies and your research design. So put in all those key points we've talked about today. Who is your target group? What's your sample size? How did you go about collecting the data? How did you go about reaching them? How many people responded to your ad, for example? How many people completed your questionnaire? Then you want to have your objectives and your key questions as well. So we talked about those at the beginning. It needs to be clear and concise. We don't need a 50-page report if we can say it in 5. So we want to be really clear, no waffle. It needs to be in a logical, organized structure. So we want to use headings and make it flow. So I've given you the order there. As I said, use visuals or infographics where possible as well. Just breaks up the text and makes it much easier. Like that infographic I showed you at the start of My Health for Life. Really easy just to see all the little pops of information, rather than that being buried in text or even a table. And tell a story to make the data meaningful. So we want to actually talk about where we've come from, what this means, how we developed our personas, or the story of our participants, to actually make it meaningful. How does it relate? How is this going to be translated? So tell them what the results actually mean to their business or to their organization. And that's really helpful. And it will also ensure that your report's actually read. So put some narrative around it. You know, I work in a world of academia, and quite often when you translate a report, an academic report, it needs to be written in a totally different style for our partners or our industry partners, because they're not quite so interested in statistical significance. They want to know what worked, for who, and when, and how, in which context, or they want to know what's going to work, or what do these people actually look like? What do they think, feel, believe? What's important to them? So that's the story that we want to weave into a report. Then, of course, just as we finish off, We really need to consider ethics as well. So we need to consider privacy issues, identifying people, and remember the key in ethics is to do no harm. So we want to protect our participants and make sure that we keep them safe and that we keep their information and their data safe as well. But there's plenty of resources that you can look at if you need more help with ethics, or feel free to get in touch. So just in wrapping up, good market research depends on good information. As I said before, garbage in, garbage out. So a well-planned market research program designed with a clear plan, a clear roadmap, asking good questions, you'll get really good quality information and insight that you can then translate into action as well in your firm or your organization. So think about, what do you want to know about your customers? So thank you. And there's my information if you would like to get in touch. And I think you do have my email address in the email that Morgan sent as well. I would really love to hear from you. We, of course, conduct market research at Social Marketing at Griffith. We do a range of different research, actually, so we can work with you. We do a range of different consultancies. Certainly something that we have a lot of expertise in. As I said before, we use the CBE model, so co-design or co-create, build, and engage and evaluate. Now, if I can just make my